Hey everybody, I hope you guys are ready for our webinar today. We have an exciting topic for you. This is about the professional role of the nurse practitioner. And this is really for those of you who kind of want to know what those next steps are after get ready to take your board exam. You're getting towards the end of your curriculum in school. Just will let you know that the ANCC does test on a lot of this stuff. So that if you're planning to take that exam, that would be something that I would definitely be writing down, paying attention to. And the AANP doesn't necessarily test on all this content, but this is something that you're going to want to be familiar with regardless of which exam that you take, because this is going to be the steps that you're going to have to go through once you want to start getting out there working, and some things like legal things that you need to kind of be aware of as you're in practice. So again, very important content. It's not necessarily like a system of the body, but it's just something that we all need to be aware of as nurse practitioners. So if y'all just put in the chats here which exam y'all are hoping to take coming up, if you're kind of on the fence between the two, or what your deciding factor is going to be, I just kind of like to see that. So as we go along here, I can help with any questions that y'all might have. So y'all can take a minute and put that in the chat for me, and I'll circle back around and look at that here in a little while. All right, so the first thing that we're going to start with today is licensing. We're going to go through, okay, ANCC in 1 week. All right, wonderful. I took ANCC too, Michelle, so you're going to do great. So we're going to go through some terminology, and we're going to go some step-by-step process of transition from student to FNP. As we're going along through here, if you have any thing that y'all want to add, just stick it in the chats. So the first thing that you're going to have to do after you pass this board is obtain your licensing. Okay, this is the first step of your process. This is when you go through an act of obtaining permission to practice from a higher authority. So if you are going to FNP school, you most likely are already an RN, and so you've already done a licensing process by obtaining your State Board of Nursing licensure. So when you took your certification board exam, like the NCLEX, whatever you took, your State Board of Nursing granted you a license to practice, right? So it's going to be the same thing when you take your FNP boards. So you're going to get another license from your State Board of Nursing after you take your board exam, and then your scope of practice will be determined by your State Board's Nurse Practice Act. I have seen sample questions on here about State Board Nurse Practice Act. What does that do? What does that entail? And I've got it right here for you. It's the scope of practice determined by your State Board of Nursing. It's basically your nursing rule book for all nurses practicing in the U.S. It helps with our scope of practice. And this is something that is going to be determined by the state board. And so this is something that you're going to want to be familiar with as you're getting into practice. You know, if you're already practicing as an RN, you're already probably familiar with this a little bit. Well, they're going to have parts in there about advanced practice as well. So just be mindful of that and know where to go on those websites. In addition to what is required in the educational training and designation of the nurse practitioner title, this legislation will function as our rule book. Okay, so just something to be mindful of there. All right, the next step in the transition process is going to be something that you haven't done before. It's obtaining an NPI number. Now, an NPI number is going to be the National Provider Identifier Number. This will be coming from not from CMS, but they are the ones that require us to have this NPI number. But this was actually established back in 2004 with the Balanced Budget Act. And this is going to be a standard and unique identifier that applies to all health providers, health plans, and clearinghouses. And CMS developed the National Plan and Provider Enumeration System to assign NPIs. So there is a website that you go to. You can just Google NPI number. It'll bring up a wealth of information for you. I've got right here, I can put the link in the chat for y'all and what y'all need to know. So I want to go ahead and I'll put that in the chat for y'all here just in a second. Let me copy and paste it for you. And this is going to be something that you kind of go and kind of apply for on your own. Your school's not going to apply this for you. So this is something that you kind of want to know about your NPI number. All right. So the next thing that you're going to have to do, that a lot of times your job, if you're going to take a job like through the hospital or whatever, this is something that they're going to do for you a lot of times, and it is credentialing. Now, if you're going to be starting your own practice or something, this is even something that you can hire out to make sure that you have all of the pieces into play. But this here is, again, something that your school's not going to do for you. This is going to be something that you are going to go through the credentialing process. Now, credentialing is the reason for this is so that we can verify people are who they're saying they are. Just go to, university or wherever and just slap on slap that on my resume. This is actually verifying that, nope, the healthcare provider has gone through the training, they have gone through the testing, they have gone through the licensing, they have their MPI number, they have their DEA number, whatever it is that they need to work in that role. And that way, this helps the public to put trust in their healthcare providers. Okay. So you most likely have never worked in a provider role before. And so you've never been credentialed before unless you've worked, doing your own business or something, like maybe you were an OT or something like that in a previous life. And, if you were billing insurance for anything, maybe physical therapy, dietitian, things that you can bill insurance for. Or charging fees for services. So most of us who's worked as RNs, like on the hospital floor or in a doctor's office, we've never gone through the credentialing process, but it's difficult. They request all kinds of records. So one of the things that I have done is I have started a binder for myself as I was getting through school and put things in there, just everything from my CPR licensing card to, my nursing license in there, my NPI numbers in there. It has when, my insurance expires. It has everything that I kind of need to have on hand. And so this is going to be really handy for you as you go through this credentialing process. And so that is something that I can't recommend enough. And again, a lot of times your employer will help you go through this process. So just something to be mindful of, that you can't really start billing insurance and seeing patients much until you've been through credentialing. All right, this is another step that I'm going to call 3B today, okay? This is not going to apply to everyone, but if you are in a state that requires collaborative practice, then you have to have a collaborative practice agreement. So this agreement is going to be when the nurse practitioner and the physician work together to provide care for patients. And many states will now allow the independent practice of nurse practitioners, but other states will require a collaborative practice. And if your area requires this, it might be a reduced or restricted authority. Reduced is going to be where some aspects of your scope of practice are restricted, and reduce is going to be like some parts can be performed independently. And really, again, you're going to have to go back to finding out that scope of practice for nurse practitioners in that Nurse Practice Act for your state. I also have a link for you guys that I'm going to put in the chat here, and this is going to be for you all to know whether or not your state requires a collaborative practice. So this is something that you need to be aware of. Even if you're kind of, in some states, nurse practitioners are allowed to own their own business, but it's more of a reduced or restricted practice state. And so you still are going to have some sort of physician oversight. So again, this is going to vary from state to state. Check that link out, see what your state requires. All right, so now you have gone through those 3 steps and you are now ready to start seeing patients. So let's talk about a few things that we also need to be aware of. The boards love to test on these little acts or legislative bills that I'm going to go through. These all are going to come from Department of Health and Human Resources. And so you can go there and check out all of their information. That's where I pull a lot of this information from. So if you plan to work in a U.S. clinic, most of these clinics have transitioned to keeping electronic health records for each patient now due to the HITECH Act. The Health Information Technology for Economic and Clinical Health Act. That's a mouthful, isn't it? The HITECH Act. This was going to be set by CMS and encouraged by all healthcare providers and facilities to transition to electronic medical records and incorporate decision-making tools within the patient chart. So again, these are just things that help with safety, confidentiality, things like that. So I know, for example, my EHR has a Hippocrates app within it. So when I'm prescribing a medication, it has an interaction checker, and then it has Hippocrates where I can click there, look up and see the drug dosing and what it's for and all those things. Again, that's part of providing that safe care, right? And so the HITECH Act is what required us to be able to put those decision-making tools in. And the decision-making tools you'll find within your EHR are just an invaluable resource for you. So this is a good thing. This also, we have another piece of legislation that I know all of you guys know, and it's HIPAA, and that's going to stand for the Health Insurance Portability and Accountability Act of 1996. This has 5 titles to it, okay? You guys are all going to be familiar with mainly number 2, because that's the one for the confidentiality, right? But Title 1, and I don't know why we have a typo here, that wasn't on there earlier, so I'll fix that for y'all for next time. This is going to protect health insurance coverage for individuals who lose their jobs. So those who've heard of like COBRA or other things, that helps with this. Title 2 is going to be, again, your most known title in regards to privacy, but also it's the one that requires us to obtain NPI numbers to help prevent healthcare fraud and promote privacy by requiring secure EHR transactions between providers, okay? And the other thing is on Title 3, this is going to be addressing the pre-tax medical spending accounts such as HSA accounts. We're going to get into HSA accounts, PPO accounts. We're going to look at that one here in a couple of slides. Title 4 is going to be our group health plan guidelines. Title 5 will be regarding company-owned life insurance policies and making a way for us to treat non-U.S. citizens. So again, you can see HIPAA really is a broad act here. This is something that y'all want to just kind of be familiar with, know exactly what HIPAA stands for. I think I literally had a test question, not on boards, but like in school, on what does HIPAA stand for. And I'm just like, I can't remember. So just kind of be aware of, what all these letters stand for on these acts. All right, our next one we have today is billing. So again, you probably may have never billed before. As a registered nurse, that's not something that we typically do unless maybe you're working in some sort of clinic or home health setting, that is actually where you're billing for nurse visits. But this is something that you need to be aware of. The ICD-10 codes is what we're on right now. That stands for the International Statistical Classification of Diseases and Related Health Problems, or the ICD-10 codes. These are a medical classification list, and these are defined by the World Health Organization. So, for example, you are going to hear terminology related to ICD-10 codes. So when you are, making a diagnosis, it's going to have some numbers and letters assigned with it. We will eventually be going on to version 11, but right now we're on version 10. There's whole books that have been written on this. This is something that you don't have to memorize. There's not going to be a test question on what's the ICD-10 code for hypertension, but rather just knowing what it stands for, knowing that you have to have it so that you can provide billing. Also, some of the questions will ask about incident to billing. This is allowing for insurance reimbursement at a 100% rate for physicians instead of the 85% reimbursement rate for nurse practitioners. So I've got that right here for you guys. The little things, there's some little caveats to this. The physician must be in the building when the care is given. So if your physician is out that day, he's sick or on vacation, whatever it be, you cannot bill as incident 2. Also, if the patient brings up a new problem, so if they're here to get their blood pressure rechecked because, say, the physician started them on blood pressure medicine a couple of weeks ago, and then now they're complaining of abdominal pain, and you start working that up, that is no longer going to be allowed as incident 2. If you only address the blood pressure, then we can bill it as hypertension follow-up, incident 2 billing. But if they start coming up with a new problem, or we note a new problem, this is going to be something that we are going to shy away from the incident 2 billing. So just something to be mindful of there. If you bill a lot of incident 2 billing, this is something that I would look into a little bit more. I would find out what my policies and procedures are at the facility where I'm working. Billing, a lot of places will have billing departments that kind of help with this. I know we have a billing resource people that we can call if we're unsure. So, just paying attention to that and being mindful of billing correctly. All right, so now we're going to talk about the Patient Protection and Affordable Care Act of 2010. This is, again, often called the Affordable Care Act. This has 3 main goals about affordability of insurance, helping to make it available to more people. And this expands the Medicaid program to cover all adults below the federal poverty line. It supports care delivery methods and lowers the cost of health care. So there's 3 different goals here. Just make note of those. And again, like I said, I have given you just a very high bird's eye view of all of these acts here. But again, I'm going to put on here the website for you guys to go to, the Health and Human Resources website at your own convenience. Maybe you just save this for a time when you're not getting ready for boards, Michelle. Maybe this is something you look at here in a couple of weeks. And this is something that you just want to kind of be aware of as you are going through and, applying for jobs, looking and seeing, kind of what would be a good fit for you. All right. So these are going to be some things that we hear about, those insurance buzzwords, okay? So an HMO and a PPO. So HMO is going to stand for a health maintenance organization, and preferred provider organization is what PPO is going to stand for. So an HMO is going to provide health care for a set monthly or annual fee. Often, one of the pros with this is patients will have fewer out-of-pocket expenses, but will be served by a smaller network of providers, and oftentimes out-of-network providers will not be covered. Whereas a PPO, or preferred provider organization, this is going to be a larger network. Oftentimes, patients will have to pay more out-of-pocket fees to access a larger number of healthcare providers. So a pro to this one is that patients often don't need referrals. Patients often have more flexibility in choosing who they would like to see, doctor or nurse practitioner wise. And regardless of which plan, a patient will have options to include things like vision, dental, medical, prescription, and hearing insurance benefits. So again, this is just something that you don't really have to memorize, but just kind of know what they stand for, be aware of it. You'll often see what the insurance is listed on your EHR, and just kind of can pay attention that way, when you are making your referrals or other things, making sure that things are in network for patients. A lot of times we won't know, so we'll have to ask the patient or have somebody look it up for us. Okay, so let's talk about Medicaid versus Medicare. So Medicaid is a program that provides low-cost health care, specifically focusing on people with disabilities, lower incomes, and vulnerable populations such as pregnant women, children, and older adults. Medicare is going to be funded both federally and by each state. Therefore, each program will vary for each state, and the guidelines for coverage are set by the federal government. Medicare is funded by a couple of trust funds held by the U.S. Treasury, and it is aimed to provide care for adults over 65. Those with certain disabilities, such as like end-stage renal disease, these people might be eligible for coverage sooner. Just something to be aware of is if your patient is on Medicare, there are 4 parts to it, parts A through D. I have them listed here and what they cover. A and B is going to be your traditional Medicare coverage. Oftentimes, eye exams and dental bills will not be covered under these original Medicare plans. So then patients will choose to get like supplemental insurance, or they'll purchase Part C. This is a Medicare Advantage plan. It can be bought separately from private insurance. And then Part D is going to be D for drug. So that's going to be your prescription drug coverage. So again, just go back, think about your different parts to Medicare, pay attention to this, and it may ask you something like, what does Part D cover, or what does Part A cover? And just kind of in general know what the coverage is for Medicare and the difference from Medicaid. And I think you should be okay on that. All right, we're going to go on and move here to parts of a valid prescription. This is something that I want you all to pay attention to. We have all these valid parts that we have to have. You can see that the superscription is what comes before the body of the prescription. This is going to be things like the patient's name, birth date, address, the current date. The inscription will contain the name of each medication and the dosage amount. And the subscription is the instruction to the pharmacist, while the signa, or SIG for short, is going to be the instruction to the patient, such as how much medication to take. So you can see here that this is a valid prescription because it has all of the parts, okay? I don't see a patient name on there, so we would have to make sure that the patient's name on there, but the supra and the inscription and the subscription are there. Also, you will need to put how many refills you're authorizing on there, how many you want to give them. So you can see there's quantity on there, quantity 30. And then you'll also have to put how many refills you want to give them, and then sign your name, put the address of the practice site and prescriber registration number, and your DEA number if you're writing a controlled medication. And just a word of caution, I know you all have heard this in school, but this is something that can get us into trouble that we just want to keep in our forefront of our minds, is never keeping signed blank prescriptions in your possession, and always double checking patient allergies prior to writing the prescription. So I've got that in red for you. And if you really abide by those two things, that will help to keep you safe and the patient safe when you are writing prescription. All right, guys, let's go ahead and let's do a practice question together. So you're looking to see if your state requires a collaborative practice between nurse practitioners and physicians. You're going to know which legislative document to consult, right? So which one is it? Is it going to be A, the State Nurse Practice Act, B, the Transitional Care Model Act, C, Patient Safety and Quality Improvement Act, or D, the Health Insurance Portability and Accountability Act? So think about some of those acts that you've heard of and see which one that it's going to require. So you all can go ahead and put that in the chats, what you all think it's going to be. Give y'all just a minute. That's right. You have it. Hey, absolutely, Michelle. You are ready to go here today. And so that's right. Absolutely. The Nurse Practice Act. You guys got this. So this sets the scope of practice for all nurses, regardless of level. The Transitional Care Model will be part of the Affordable Care Act. The Patient Safety and Quality Improvement Act will encourage individuals to report medical errors. And of course, we had HIPAA there for answer D. Just has a lot of words. And so again, you all know that this is our Nurse Practice Act. We're going to check it, and it varies by state to state. All right, practice question number 2 for you guys. So while working in an urgent care, you're providing care with a 9-year-old patient with a prescription for amoxicillin, 250 milligrams for bilateral ear infections, and you're going to write the prescription for the patient to take 1 tab twice per day. On which part of the will you put that information? So will that be on the superscription, the inscription, the subscription, or the signa? So think about the parts of the prescription and think about patient safety when we're writing prescriptions. Where is going to be the part where we put the information that's going to go to the patient so they know exactly how we want them to take the medication? All right, I'll give you just a minute to look here. Okay, and that's going to be the Cigna, guys. The Cigna is the part of the prescription for us to write the instructions down that the provider wants to tell the patient. Remember, this is a pediatric patient, so it's going to be best practice to include the patient's weight on the prescription. So again, go back and think about the parts of the prescription. The Cigna is going to be the part where we're going to put the instructions to the patient, where the pharmacist is going to write what the provider wants the patient to do. Okay. All right, let's talk about research for just a minute. We're going to go over just a few key points. There are a variety of ways that we can conduct research and a lot of ways that we can interpret research, right? So we want to always practice on guidelines. We always want to talk about evidence-based practice. And so in order to do that, we want to perform good research. We want to avoid things like sharp journals. We want to avoid, unreliable sources. We've talked about USPSTF recently. We've talked about ways to find good guidelines, but maybe it's a question that we have that there's not a guideline on, or maybe we're not sure where to find that. And so a lot of us during school have formulated a PICO question, and that is going to be the way that we are going to always ask our research questions both in school and in practice. So we want to see how this question is formulated. So we always have to have, a population, an intervention, a comparison or a control, outcome, and time. So I don't want to just know in women with diabetes, something about their EKGs. What about their EKGs? I actually want to know in women with diabetes with suspected myocardial infarction, right? That's our population, right? Or in children with asthma, right? And shortness of breath, that's our population. Our serial EKGs, that's going to be your intervention, okay? With initial EKGs, that's going to be your control, more accurate in diagnosing acute myocardial infarction, that's going to be your outcome within 4 hours. So there's your time. So again, just thinking about this is how you're going to want to develop your questions as you go along in clinical practice. Sometimes you might do a research project if you're still in school, and they're going to want you to use the PICO method. So just be mindful of that when you are wanting to start research of something. Again, we've talked about good research. We have a lot of different things that we can find. I have listed some sites here for you, ProQuest, EBSCOhost, CINAHL. All of these are really good resources for you, and you can put parts of your research question in there and keep refining your search over and over. And that's a really nice. I think CINAHL is the one that really does that, and that's really been a huge invaluable resource to myself. And we have a few other things like Science Direct, the CDC, Gale OneFile. These are all, again, reliable sources. So, it's just not going to Wikipedia and looking up a disease process. We actually want to be using, some sort of peer-reviewed or scientific journal when we're looking for answers to our questions. And then this slide here just talks about the evidence and research hierarchy. I really love this pyramid drawing. This is something that I have seen multiple times. We used this in grad school for myself, and it was from Glover, Izzo, Odato, and Lay. And you can see the higher up we go on the pyramid, the better quality of evidence we have. So we can see systematic reviews are going to be at the top, okay? And so we have like filtered and unfiltered information. So you can see it like at the very bottom is going to be like background information or case controlled studies. Again, all good things, but we really need to be picking studies that are up from the top of the pyramid. So what are these methodologies, if you will, that these researchers are using to put out their evidence. So just something to be mindful of, again, when you're picking out these research articles that you want to use or guidelines that you want to lean on, seeing where the data was compiled from, how it was compiled. That's going to be really important. All right, so let's talk about terminologies. A lot of times on the exams, both in school and on boards, you will see just a good old knowledge question about terminology. So let's talk about a variable. A variable is defined as any characteristic that can be measured or counted. So this is a data fact such as age, eye color, weight, whatever it be, and that is going to be a variable. A statistical significance is going to be an indication that a relationship is either fact or coincidence. So you all remember hearing about p-values, I'm sure, in statistics that you all took. And the smaller it is on that p-value, the stronger observed relationship among the variables is not coincidental. Okay, for example, if I say that researchers observed the increasing statistical significance of the grass getting greener with more sunshine instead of rain, then I can understand that the correlation of the relationship between the variables is strong. When I say that the study mentions a mean, that's going to be the fancy word for average. When you read the word median, that's going to be middle. And then when you see mode, it's going to mean the number that it's occurred the most often. The range will be the difference between the highest and lowest numbers. You guys know that. And then when a study states that it was conducted via systematic review, we can be confident that the highest level of quality evidence was found. So again, going back to that research hierarchy, something that you want to just kind of be mindful of, be aware of, okay? So there's some terminology for y'all. And then let's practice. Let's put this into practice here, okay? So you've been tasked to help lead a committee at your healthcare facility, develop a new protocol for sliding scale insulins. The team decides to scour as many sources as they can and gain a better understanding of the existing research and guidelines. They set a time to brainstorm and present the findings to the group next week. This process will be best known as what? So I want y'all to think about on your hierarchy of evidence. I want you to think about the strength of the research that you all are conducting here and what type of study was done here, okay? Systematic review, case study, prospective study, or a literature review. So y'all can answer this in the chats. Then we'll go over the answer together in just a second. So thinking about what the team is doing here. If you're not sure how to take your best guess, is going to be thinking about the stem of the question and thinking about what type of research they're conducting here. Brainstorming, what part does that go with? You want to take a whack at this one? Give you just another second to answer. All right, this is going to be known as a literature review. This is when you look at the current research that's already been done and find out what already is out there on the topic. This is one of the first steps of the research process. So remember that literature review is going to be kind of at the bottom of that hierarchy, okay? A case study is when someone is faced with a particular problem that facilitates learning using a variety of data sources. So I know we've all done a case study before. Prospective study is when individuals are followed over time as the circumstance changes. And a systematic review is very focused and may be conducted later on in this scenario. But first we have to find out our literature review, right? So that we can see what things have been done already on that topic, okay? All right, let's talk about practice question number 2 here. So you're reading through a nursing journal and come across a particular article that piques your interest, and the abstract discusses that the researchers wanted to know how often patients with chronic kidney disease experience proteinuria, and the data was compiled from 20 different renal clinics. What type of study do you suspect was conducted? This is not something that we talked about on this right here, but this is a really great example of a question. Talks about the type of research. So we have qualitative, quantitative, meta-analysis, or longitudinal? I got some guesses coming in, so we'll move right to the answer is B. So this is going to be anytime there are specific narrow questions with a numeric data analysis via statistics, we're dealing with a quantitative study. Qualitative studies are usually based on opinions, interviews, broader topics. Meta-analysis is the examination of several independent studies used to determine trends, and a longitudinal study refers to a repeated measure used to follow someone over a long time. So if you miss these questions here, you might just want to go back and look over some of the research topics again. If you had taken any type of scholarly class, maybe look over those notes a little bit, and you're going to be ready to go. Again, this is a very small piece of ANCC, so don't stress over this too much. I think there's just probably a few questions on the boards regarding this. Okay, let's talk about practice question 3. You're examining Mr. Jones. He's a 70-year-old veteran, and he is doing his annual wellness exam. He was exposed to Agent Orange during his time in the military and is participating in an upcoming clinical trial that compares those exposed with healthy lung function. Based upon this statement, you suspect that this most likely is what type of research? So give you just a minute to think about that. Okay. This is going to be prospective, longitudinal, retrospective, or lateral. That's right, Mandeep, you've got this. Absolutely, this is C. So retrospective studies contain data that compare those who have been exposed to those who have not been exposed. I know that sounded like a mouthful, didn't it? Lots of students have a hard time with these questions. So again, don't beat yourself up. Look over your research just a little bit. If y'all want to deep dive in a little bit more, you can come to our live review. You could book a tutoring session. And we can kind of help you hash this out a little bit more. Okay, so the answer for that one was C. Okay, retrospective study. They compared, him who had been exposed to Agent Orange versus those who had healthy lung function. Okay. All right, so let's go ahead and look at professional role and ethics and laws. So we're almost through our content here. Y'all are doing a great job hanging with me. And again, we can kind of go back over some of the research again at another time. There's other opportunities to do that. All right, ethics is going to be defined by the National Institute of Health as the broad term that covers the study of the nature of morals and the specific moral choices to be made. And most healthcare organizations have set standards to provide competent service to the public from trustworthy and trained individuals. So we're going to start with just a little bit of terminology here so that you guys can be familiar as these questions ask and you know exactly what they're asking. So a living will is a type of advanced directive. This is a legal document. It's a written statement that ensures any healthcare related decisions you've made for yourself are carried out in the event that you're unable to advocate for yourself. So again, if you've been working as an RN, we're always asking patients about advanced directives, right? Because we always want a copy of those so that we know what the patient's wishes are in case they do become incapacitated. A power of attorney, that's going to be a legal document that can appoint an individual to make decisions about Medicare in the event you're unable to make them for yourself. So a lot of times people will not only have their wishes written out, they'll also have a person that kind of helps advocate for them, make sure that those wishes are carried out. Oftentimes this is a family or friend, someone who has the best interest of the patient at heart. And then also a guardian ad litem is going to be a person appointed by the state to make decisions for an incapacitated person or a child. So specifically in a court case, so maybe that patient, maybe it's went to the ethical board of the hospital or, whatever it be, the patient has not been able to make their own decisions. They don't have a power of attorney. They need a guardian, and then the court will help to, provide a guardian for that patient. All right, so these this is going to just be a fill in the blanks activity for y'all. I'm going to give you 2 or 3 minutes here. I want you all to take your notepad out or your phone or whatever, and I want you all to fill in the blanks. I want you all to see if you all know the terminology for these words. A lot of times the both exams in school and then also on boards will reference this terminology. They'll talk about some of these questions, and this is just some words that you want to be familiar with. So I'm going to pause for just a moment, and I'm going to let you all take a look at these and try to come up with some definitions. All right, how did you do? I've put the terminology here for you guys. Oh, sorry. So let's go through some of these together. I'm not going to read the entire slide, but I'll just touch on a couple of them. Beneficence is the obligation of a healthcare provider to always act for the benefit. So you can see benefit kind of in that word of the patient and prevent harm. Autonomy, we often like to function autonomously as a nurse, right? So understanding that each person is worthy to make their own healthcare decisions. If deemed an adult of sound mind, that's kind of what that means for patients. Veracity, always telling the truth. Fidelity, loyalty to patients and your professional code of ethics. So just paying attention to what all of these terms mean, because again, you may come into contact with them on your exam. All right, so we're going to practice just a few of these, applying these terminologies here, okay? So while seeing patients in a busy primary care office, you are going to take the time to run your medication through the interaction checker. The nurse practitioner notes that there's an interaction between the two medications and decide to change the regimen. So you're going to explain this to the patient and they're agreeable to take the safer option. This is going to be an example of what? Y'all can put that in the chat. You guys got it. That's right. It's C. Very good. So non-maleficence is the commitment to do no harm. Utilizing your interaction checker, that's probably going to already be in your EHR anyways. It's going to help to promote safety and decrease the risk of harm to the patient. So good job, guys. All right. In closing here, I just want to talk about legal protection for ourselves. Malpractice claims for nurse practitioners have been on the rise in recent years, and these are just a few of the ways that we can protect ourselves. Always practice within the scope as defined in the State Nurse Practice Act. Maintain your licenses, your certifications. Remember that binder I told you about? Stay current on clinical knowledge. Attending things like this is going to be really helpful for you just as you go along. You're going to have CEUs to keep your practice up to date, your license up to date. So just kind of, looking up answers that you're not sure as you go along. Document promptly, including objective findings as well as signs and symptoms to report. You know, if your patient comes in and complains of abdominal pain or blood pressure issues or whatever they're complaining of, when would they need to elevate care to the ER? When would they need to come back to the clinic? You know, telling them that and then writing that down for them. Maintain files that support your character, such as performance reviews or other things that you can, you know, kind of vouch for if you were happen to be, you know, summoned for, you know, to go and stand before the jury and the judge. So just some things to keep in mind for yourself. And then also, I would just add to that insurance, keeping your insurance up to date is going to be important. So this is just a little pause here for you guys before we get into another couple slides before we end. This is the nurse practitioner live review information, and then also our QBank information. So everybody should be signed up for the QBank. I cannot stress that enough. And the reason being is it's free for 30 days. So those of you who are getting ready to test coming up, take advantage of this offer. It's again free for 30 days. There's no obligation after that. If you love it and want to keep it, you can do the 60-day access for $29. There are over 1,550 questions, and we're adding to that literally weekly still. And this is a really good opportunity for you to practice questions just like we did that are board style that have been written here by the FNP team at Archer Review. Also, just a reminder, we have another 3-day live review coming up. We just set the date for that last week, so a lot of you guys may not have heard yet. July 19, 20, and 21 is going to be our live review date coming up. If you missed the last one, this is going to be an in-depth review of your must-know topics. You're going to have live expert instructor interaction. I know that we always have an NP in the chats. We also give 30 additional days to the recording. So if you miss something and want to go back and pause and rewind it, you can do that. And $50 will be for all 3 days. That'll be a full day Friday and a half day, like usually in the morning, Saturday and Sunday. And you can scan here to register for that webinar, or also the webinars that we have coming up through the summer, just like this free one you're attending today. You can register right here on this QR code. Also, we would love to connect with each and every one of y'all. We have a very active social media following and page is on things like Facebook, Instagram, even TikTok now. And you can go and look on there, and we post questions of the week. We'll post illustrations on there. We'll post all kinds of really good stuff just to kind of help you as you're reviewing on the board. So make your scrolling educational for yourselves. That's again a free resource to you, and you know, we'll even stream these webinars from that page as well. So if you miss one on the website, you can kind of go back through and scroll there. Also, any questions that y'all have, we have our nurse practitioner at archerreview.com email set up for you. We'll be happy to answer any questions you have. And then in the chats, I did put on there the private tutoring link for you guys. So again, lots of resources, some free, some not. And just looking on here and taking advantage of all the opportunities that you have afforded to you here at Archer Review. All right, so it's now time for just a little bit of Q&A. If y'all have any questions, if y'all have any concerns, or you know, want to talk about this more, let us know. You can reach out via email, and if you have anything that you want to wrap up, you can put it in the chats. Otherwise, we're going to plan to see you back here in just a few days for another webinar. So, all right, I'll stay here for just another minute or two. Rachel's in the chat, and so we'd love to connect with you a little bit more and answer any questions about all the exciting things coming up here at Archer. I'm going to pull that back up for you guys. I'll leave that on the screen for another minute or two, and you all can take a look and see if there's anything on there that would be good for you to help supplement your learning and your study. All right, we're going to wrap it up then. So, if there's anything that you think about that we can help you with, just send us an email and connect with us on social media. And otherwise, we'll see you again soon. I'm here next week. So, come and join me again. It was great to have all of y'all. Good luck, Michelle, with your test. I know you're going to do great. You are going to be ready to rock and roll next week. So, yes, you're welcome. You're welcome. Thanks for joining me today. And I hope y'all have a good rest of the week. I hope it's sunny and pretty where you're at. It's very sunny and hot down here in the South. So hope it's nice where you're at today. You could take advantage of the weather where you're at. So, all right. Well, we'll talk to y'all soon and have a great week.